McDermott, president of the Transplant Financial Coordinators Association, and it's an honor for me to be here to talk to you today about maybe some of the barriers for transplant, and specifically whenever it pertains to finances and insurance. So um, don't don't leave me. I know talking about the money aspect of transplant can be a little scary, but that's what we're here for, right? We're here to talk about it. Sometimes talking about the hard thing get you through it. Um, I always say to my patients, a good patient is an informed patient. You've already got that first step. You're here to learn. You're watching this presentation today. So that's what it's all about, is empowering you with information and knowledge so we can help you out through this journey. Not only am I the president of the Transplant Financial Coordinators Association, but I'm also a manager. I'm a manager at our transplant program. I'm a financial manager, and I've been in transplant for about a little over 25 years. So it's a wonderful part of my life. I've learned a lot along the way, and I'm happy to share with you some of my experiences today. So today we're going to talk about the transplant journey. We're going to talk about what a financial coordinator is. Who is that? What do they do? What's their role? How can they help you? We're going to talk about what a financial plan looks like. What is that? What are some of the key components of that? And then we'll just kind of summarize some of the key takeaways, some things that I really want you to take away from this presentation and take home. Just some key points for you to remember along the way. So let's go ahead and jump into your transplant journey. Transplant is exactly what it is. It's a journey. And it's usually kind of broken up into four different phases. You have your pre-transplant, which is your transplant evaluation for your kiddo. They will go through a lot of testing, a lot of clinic visits, a lot of labs. So just a lot of things to see if they're an eligible candidate for transplant. Once, hopefully they make it through that piece of the journey, they'll move along to their waiting list. So they'll get, listed for their transplant. And then, the third phase is the transplant surgery itself. So yay, that's what our goal is. That's the end goal, is to get your kiddo transplanted successfully and to live a wonderful, long, sustained life. And then you have your post-transplant care. So once you're after transplant, once you're a transplant patient, you've received, an organ or a stem cell transplant, your kiddo is always going to be a transplant patient. So that's all that aftercare after transplant. And with all these different phases throughout the journey, you've got a whole team of people at your disposal at your transplant program. So one of the things that you're going to have is your transplant team. So your transplant team, just about, every transplant program has a team that's going to work with you and work with your child to get them to transplant. You're going to be assigned a transplant coordinator. So that's a nurse who's going to get all those tests together to make sure that you've got the right appointments scheduled. They're going to advocate, for you to get your kid transplanted. You're going to have a transplant surgeon that you're going to meet with. You're going to have transplant physicians. So there's a lot of physicians that are on staff, maybe a nephrologist, a hepatologist. There's a whole team there to help you navigate through that clinically. You're going to be assigned a social worker that will meet with you. So that social worker will be there for you. Yeah, probably a dietitian, a pharmacist, and then you've got your financial coordinator. And that's really what I'm here to talk to you about today, is what that financial coordinator's role is in this journey, and talk about some of the things that they're going to do for you to take some of that burden off of you. Getting a transplant, your kiddo is taking care of your child should be your most important focus, right? So the transplant financial coordinator, I'd like to think one of their most important roles is to come alongside you and take some of that burden off of you as far as worrying about, the financial piece of it. They're going to take on a lot of that duty for you so you can focus on taking care of your child. So one of the things that they do is they handle the insurance side of transplant. So they're going to get all those approvals for all of the testing needed. They're going to obtain benefits. They're going to just contact your insurance company to get all of the information that they need to make a good financial workup, so to speak. So you're going to get a clinical workup and a financial workup. They're going to make sure that they have the right approvals with your insurance company. Let's say if something gets denied or something like that, they are there to appeal those denials and to work with your insurance company to navigate that piece of it. And sometimes they'll involve the doctors. They'll do a peer-to-peer review and work with your insurance company. They're going to fight for you and for your kid to make sure that transplant happens. If it's something to where there's maybe your transplant program is out of network with your insurance, they're going to secure a single case agreement to work one-on-one with your insurance to see if they can get a contract just specifically for the care for your child and for their need. They discover those things, those hurdles with your insurance, and they, if they hear a no, it's not always a no. There's always a workaround whenever you're talking about insurance and contracts and transplant networks and all those things. So that's one of the things that they will do is to work with the insurance company to make sure that a contract is secured. Most importantly, they're going to sit down with you as a family, and they're going to talk to you about those benefits. They're going to talk to you about your insurance. They're going to tell you maybe what's available to you, maybe some things that you're not aware of. So every transplant program is different. Every state is a little different as well. Some transplant programs have very unique things that they offer to each patient. So they're going to be there to let you know about all those things that are there and available to you. Maybe it's grants, maybe it's pharmacy benefit cards, something like that. But they're going to be there to let you know about all of those things and to kind of hold your hand and help you through that. And they're going to make sure that you have a solid financial plan, and they're going to work with that together. So when I say the word financial plan, what does that mean? And we'll talk about that here in just a minute. But one of the things that I want you to, I think it's always good to know what to expect. So there's, you don't go in kind of blindsided. It's always good to know what to look out for on your journey for transplant. So one thing that you probably need to be aware of is that there's going to be a lot of questions, not only from your transplant team, but also from you, right? You're allowed to ask questions. So I would encourage you to write down some of your questions as they come up and bring those questions with you whenever you go to your visits. And just, that's your right. So, and they expect that from you. But there are going to be a lot of questions coming your way. And some of those questions might be repetitive. For example, the social worker may ask a lot of the same questions that your financial coordinator is going to ask you. They may ask you about your income. They may ask you about your household size. They may ask you about your employment, because all of those things play into your financial plan. And, don't think that we're being nosy. I hope that you don't think that. Just know that they are asking these questions for a specific purpose. And just know that those questions are necessary. So Just be patient with them. Another thing that you can expect is lots of information. So you're going to get a lot of information thrown at you. So just be prepared for that, especially in those initial pre-transplant days. You're going to get a lot of information about your testing, a lot of information about your financial plan, about drug coverage, and you're going to get a lot of information, but information is a good thing, right? It's a really good thing. You're also going to get lots of answers. So if you have questions, you can expect a lot of answers. A lot of answers to your questions that you have. So that's another positive thing to look for. And then you're going to see lots of new faces. Those faces are there to help you. Your transplant journey is going to include a whole team of people there who are there for you and at your disposal. And they're going to probably become a lot like your family. They have the same goal that you do, and that is to get your child to transplant, to make it be successful, and to go on and lead. We want to see them live long, happy lives. And so that's our goal. And I think it's good that, whenever we all have the same goal, to know that we are all on the same team, that makes things a lot easier. So let's talk a little bit more about a financial plan. Your transplant financial coordinator is there to support you through this journey. They carefully review your insurance benefits and details of your transplant type. So depending on the transplant that your child needs, whether it's a stem cell transplant, a kidney transplant, a liver transplant, whatever transplant that your child needs, your financial coordinator is the expert in that field. They're going to know what questions to ask your insurance company, what questions to ask you. And they're the experts. They understand insurance coverage. They understand how things work. And they're going to let you know your options. There may be some things that you're not aware of. They're going to let you know. So once your child gets their transplant, that journey doesn't end, right? So they're there to help you through kind of looking into the future as well, not only the present, but also help you to think about the future and how you can prepare and how you can plan financially for all the different phases of transplant throughout that whole journey. So let's talk a little bit about coverage for transplant. Who covers transplant? Well, Medicare, which is government insurance, Medicaid, which is more of your state-funded insurance, and commercial insurance. So that's like maybe an employer group insurance. There's just lots of plans that are out there, and a lot of times it's state-driven. So that's just something to be aware of. So there's lots of different types of insurance coverages out there, depending on your personal and your family's, financial situation. So let's talk a little bit about what's covered. So most of your insurances are going to cover all that testing necessary to get your child, through that transplant evaluation. They cover the surgery. They cover the follow-up care after transplant. Some insurance companies also cover travel and lodging benefits, not only for you, but also for maybe if you have a living donor. So some types of transplants do allow living donors to come in and donate to them. So that's, maybe like an allogeneic stem cell transplant, a kidney transplant. Some transplant programs even do living liver transplant. So just depending on, there are some stipulations, but your financial coordinator will get with your insurance company and kind of get all those details and share them with you. And then they also have medication coverage. So medications are very, very, very important. It's important to have coverage for those drugs. And that's something that will be laid out and kind of discussed with you also throughout that pre-transplant phase. So let's talk a little bit about how can you how can you help as a patient? What are some things that you can do to make things a little bit easier, um, and to kind of, help out along the way, and to be helpful? So the first thing, and I think it's probably one of the most important things, is to notify your financial coordinator if you're thinking about changing insurance. Sometimes insurance changes are not something that you have any control over. Let's say, your child's covered under your insurance and it's your employer insurance. Well, let's say your employer plans on switching from maybe Cigna to United Healthcare, or from Blue Cross, to another insurance. So that's not always something that you have control over. But once you're aware that that's going to happen, please contact your financial coordinator and let them know. Your financial coordinator is going to have to contact that insurance, probably obtain, a separate and new authorization for that. They're going to have to, check all those benefits again, and find out what, the ins and outs and what's covered, and how it's covered, so they can relay that information to you. So, also notify your financial coordinator if you change insurance. So any kind of changes that you see with your insurance, please, please, please work with your financial coordinator. If you have an insurance change, maybe you were in network, but maybe that new insurance, maybe your transplant program isn't in network with that insurance. So they'll need to know that immediately, so they can contact your insurance to work on a single case agreement, to get your child covered. So also be available to answer calls from your insurance company and from your transplant team, from your financial coordinator. Always be available. I know a lot of us, see a weird phone number pop up on our cell phones, and we're like, we're not going to answer that. Well, it's very important, if your child, if your kiddo's going through this journey for transplant, that you answer all those calls. If it's spam, click, just hang up, right? But it's very, it's important that you, be available to answer questions. Your insurance company might call you. A lot of insurance companies are assigned transplant case managers, and they like to have close contact with you as a guardian or a parent, to talk to you and to stay up to date. Also, be compliant with testing. Be compliant with appointments. If you're not going to be able to show up for an appointment, just give them a heads up and say, hey, I'm running late, this or that. Compliance is a big, big, big must whenever you're talking transplant. So just make sure your kiddos, attending their appointments, and getting all their testing done. And, the sooner all that happens, the sooner you can move along with that journey. Also, I always, reach out to the fundraising organization. So another thing that your financial coordinator is going to do is to tell you about fundraising options. So there's several organizations out there, CODA, there's Help Hope Live, there's lots of different organizations out there. And then also there may be some resources like grants or something like that are specific to your area or specific to your transplant program. Your financial coordinator is going to know all those things, and they're going to be there to share with you your options, so that you'll know what all's out there. I always tell all of our patients, look, all you have to do is just make a phone call, right? We try to have college funds. There's all these different things that we try to do for our kids. Why would you not at least try to get some fundraising done for your child? I don't care if you have 100% insurance coverage. It's always a good option to have fundraising there, because once your child's transplanted, they're going to need drugs for the rest of their life. They're going to need visits and appointments. And, if you can secure some funds for your child now for their future, and that's just one less thing, as they grow up and get older, if you can have that little nest for them. So I encourage you just to reach out to one of the fundraising organizations, and then they will, they'll take the baton from there and let you know. And I think you'll probably find out that it's a little bit easier than what you think. So, but always just make that first initial phone call and reach out to them and then work with them. So here are some successful links for like the Children's Organ Transplant Association, CODA. They're one of the fundraising organizations. We've got Help Hope Live. Here's my association, the TFCA, the Transplant Families. There are so many organizations out there that are helpful. Too many to put on one slide, but there are links to information and other organizations probably on every single one of these websites to get you more help. So just, the more knowledge that you can have, there are resources out there to use. So feel free to kind of look around these different websites and see what's out there for you. So some key takeaways, some things that I would like for you to take away from this presentation and from today's discussion. Knowledge is key. An informed patient is the best patient. Like I said, you're already here. You're already attending this conference to find out how you can, be your best you and to be, to get the best information for your child's journey. So I wanted to share with you that, like I said, I've been in transplant for probably like a little over 25 years. I started when I was just a little baby. But one thing that I have learned, especially in the pediatric world, is that, these transplant programs are going to, I've never experienced a child being turned away or, turned down care for a lack of financial means. So there's always an answer. So there's always a way through. There's always a bridge to transplant for pediatric patients. They're our most vulnerable population. So I just want you to not be afraid of that and to try not to worry about that. Communication is key. Keep the lines of communication open. Ask questions. So don't be afraid to communicate any questions or concerns that you have with your transplant team. And then patience is key. And that also comes both ways. If you give patience, you will usually get patience. Transplant is a journey. You're not alone. Just be patient. Sometimes things take a little bit of time. And, I know, it's your child's health. And we all have the same end goal. So just know that your transplant team is there to help you along the way. And just be patient and it'll all, come out okay in the end. So those are some of the key takeaways that I wanted you to have and to learn from this. So thank you again for letting me share some of this knowledge with you, and thank you. And I'm happy to answer any questions. So now we're going to go into the question and answers portion of the session.
Hello and welcome, everyone. We are so thankful to have Elisa McDermott with us. Thank you so much for joining us today.
Absolutely. Glad to be here.
We have some questions in the chat for you. I'll go ahead and kick it off with questions. And we'll get started. What are the most overlooked financial resources families should know about?
Probably one of the most financial resources is fundraising. So fundraising is there. It's, a lot of times when, patients and families hear the word fundraising, they kind of get a little bit, overwhelmed, like this look of that's overwhelming. But it's not. And what I always tell our patients and our families is, look, here are the organizations, just give them a call. And I promise if you'll just give them 5 minutes, they'll explain to you. And, these are organizations that have been there for a really long time. Especially in the pediatric world, who doesn't want to help, a child? So I think that's very underutilized, and that's something that they should definitely do. So connect with, we've got some links on from my PowerPoint, but like CODA, Help Hope Live. There's lots of organizations out there. So also connect with your transplant program, and they'll have some advice as well. So with your financial coordinator or your social worker that's assigned to you at your transplant program, and they'll be able to get you connected. So,
and I'll say, as a family that's done fundraising, they don't want the family doing the fundraising actively when you're waiting for your child's
absolutely.
transplant. So it will be a friend of the family or some family that will be helping you out with that. You are expected to be at your child's bedside and helping there, and
Yes.
they won't ask you to do that. It will be someone on your support network, your team. So don't worry. It's because we know that where your place is right next to your child during that time.
Absolutely. And they have it down to a fine art now. The creative ways that you wouldn't even think of, and now with the internet and things. So there's just lots of things that, if they'll just give them a few minutes to explain the ins and the outs and go from there. But I think that's a resource that's there and needs to be utilized a lot more.
Agreed.
Yeah.
That was a great answer. All right, the next question is, are there specific grants or monies available for pediatric transplant families?
Yes, there are. There are some, and some of them may be, with the fundraising organizations, but then also they may be program specific. They may also be organ specific. And so, again, I would point the families back to their transplant program, back to their social worker or their financial coordinator, and find out what their particular transplant program may have to offer. Maybe it's something in their area, or maybe it's their particular organ. Like sometimes blood cancers have their own, or kidney might, or heart. So I would point them back into the direction of their specific transplant program to get what's available to them.
Yeah, definitely talk to your social worker. I know a ton of
Yes.
gas programs, grocery programs.
Yes.
They know that you're struggling and they are not going to hold back when you're waiting.
Absolutely. Meal tickets, or even grants. Some of them are even disease related. So just really important to connect with your transplant center locally.
Agreed. Oh, also 211. I always forget to put out that resource. I know that's here in some other states too, but they help with other things. So
yeah.
Your social worker knows better than I do.
Absolutely. Absolutely.
The next question is, how can I appeal an insurance denial for my child's transplant related care? So maybe not transplant directly, but anything associated.
Oh, so I would, so it really depends on the payer, but definitely appeal it. So probably the best thing to do is to contact the insurance company, get all the details of the denial, and then work, with your transplant program. And hopefully you have someone in that office that's working with you. So just don't give up. Appeals are, if the patient usually has wonderful success. The patient is approaching it and attacking it, and then also the doctor's office or hospital, if they're working on that too. So there's just lots of different variables. So my contact information is on here. So if they're always willing to reach out and see if I can offer them any more detailed advice, because it's just it's kind of tough not knowing all of the details of it, but I would definitely not give up. Do not give up on the appeal process and reach out to the insurance.
That's great. Yeah. And definitely your team will know who to direct you to. They've
Absolutely
been through this a million times, whether it's a medication or a therapy or something. They've gotten really creative at figuring these things out. So
yes,
the teams that know how to do this.
Yeah. But and be persistent. Sometimes they just want to deny and maybe just be persistent. Don't give up. Don't let that first no be a no. So yeah.
There you go. And mamas and dads out there, you are persistent, and I'm sure that's what's helped you get your child to this point. So yeah, keep the fight up for that. I know we've been there as a family, and it's tough. So but you
Definitely.
can't. Next question is a good one. My social worker told me that it is very beneficial to have my child covered by Medicare before her kidney transplant. Do you agree? And how does Medicare help kidney patients?
yes, yes, and yes, and yes, and yes. I cannot stress that more. So, especially if your child is on dialysis. So, if your child is on dialysis, they're, pretty much for the most part already eligible for Medicare, but then you do need to go in and apply for that. But that's going to help with medications. It's going to help cover like if there's a living donor that's involved. And also, not only that, but if you have another insurance, your other insurance is already paying for dialysis, and a lot of them will force you to get Medicare. So there are some rules and some guidelines around Medicare, but yes, yes, yes. Do sign up for the Medicare. Talk to your financial coordinator. She's going to be able to, and also I think I put some links to maybe some of the Medicare website. But your financial coordinator is also going to probably tell you the same thing, or they should, and advise you a little bit further. Maybe provide some more information about your particular situation. But yes, definitely, yes, get Medicare.
I agree. We're not on the kidney side, but I think that's amazing for those kidney families that are listening today. They have some great resources that aren't available to the rest of us, and they should definitely take advantage of that.
There's also the National Kidney, the Kidney Fund that can help with some of the premium payments and things like that. So ask about help with paying for Medicare Part B and things like that. So the social worker or financial coordinator can let you know about other resources and financial help with that.
Oh, that's amazing. That's an extra bonus tip.
It is. It is.
We've got a couple of extra questions if you have a few more minutes.
All right.
Are there certain worksheets or tools that you find beneficial for directing patients to for looking at coverage benefits? Because it can be complicated, and I'll let you answer.
Yeah, particular tools. So from a patient standpoint, anytime you're talking to your insurance, always ask about transplant benefits, because most of your insurance companies, they'll have a department that's specific and special to transplant. So anytime you're talking to your insurance, always talk transplant benefits versus just regular old medical benefits. So I talked a lot in my presentation about transplant networks. So they have their own case managers, their own transplant usually has their own department within the insurance company. So just find out what those needs are in yeah, so that's probably my best advice. Yeah.
That's great. And I would encourage everyone to kind of, sometimes you have to look through a bill that you might need to be itemized. So sometimes you get a blank, like a big chunk bill. And sometimes in order to write something to the insurance, you can always ask the hospital for an itemized bill so you can make argument a little bit more, I guess, delineated so that they can answer those questions.
Absolutely. Absolutely.
That was very helpful. Okay, so then the last question, are there any fundraising programs post-heart transplant for my kiddo?
Post? I believe so. That's a good question. I can find out. But I believe there is. So, with transplant being the qualifying indicator.
So we have an answer. It says CODA can help post-heart transplant.
That was exactly what I was fixing to say, actually. So yes.
Thank you, Danielle, for adding that in. I suspected that was the case, but it was good to have confirmation.
And the link should be there in my presentation. So feel free to click on that link.
Awesome. It's also in the chat. So please check out those programs. They often have money from other places, even the fundraising programs, to get you started. So give them a look. If you don't like to, fundraise, or if you don't have a family network that wants to do that, it's okay. But it never hurts to give it a shot and see what's going on.
Absolutely. Absolutely.
Oh, thank you, Lisa. It has been just a joy to talk to you as always.
You too. Yes.
Oh, absolutely. And I encourage all of our listeners to please reach out to Lisa if you have any questions. She'll help direct you to the right person on your team that will be able to help you with any of these. We know that finances with transplant are it can be scary, especially on top of all the other scary surgical things that are happening at that time. So it doesn't have to be.
Right.
Glad to have you with us today and answering these questions for us.
Thank you for having me. This has been wonderful. So I appreciate it. Appreciate you having me here.
Thank you, Lisa. All right. Thanks to our audience. We'll see you at the next session in a few minutes. Goodbye.
Thanks.